So the earlier we replace teeth, typically the less expensive it is and the more predictable the outcome is. A lot of the times we can replace the tooth the same day that we take the tooth out with a dental implant. If we wait, you lose bone, you lose tissue, you end up having to go through more surgical procedures to regain that bone and tissue back, and the additional costs start to rack up with that as well. So the sooner we get to replacing the tooth, the better and less expensive it is going to be for the patient. So after you lose a tooth, the bone atrophies, or it gets smaller and shrinks. The tissue around it shrinks. The teeth start to move because they don't have their buddy tooth to keep them in place. So the teeth start drifting around. So if you wait a very long time to get a tooth replaced, a lot of times we have to do orthodontics to get the teeth back into the correct position, do bone grafting to rebuild the site in order to get an implant into the bone predictably. The sooner we get to replacing the tooth, the less work we typically have to do. It's important to have the implant placed correctly the first time, because typically when an implant fails, we lose a lot of bone and tissue. It's an aesthetic concern for patients, especially if it's a front tooth. Unfortunately, there are a lot of times where implants aren't done well first, and I see a lot of patients in my practice with failing implants that we have to go in and correct and get done right so the patient is actually getting the benefit of a properly placed dental implant. So you can start your journey to your new smile by coming in and seeing us for a digital smile design. We'll have a consultation, take lots of pictures, take our scans, and then be able to come up with a treatment plan and options for you that's going to get you to the smile that you want.